Good morning again. Thank you so much for joining our session today and wanted to learn a little bit more about UnitedHealthcare. My name's JP de la Cruz. I'm the agency manager for the state of Florida, just on the ACA side. If you have any questions about ancillary, that's your guy. If you have any questions about Medicare, 100% you know a lot more than I do. All right. So today I'm joined with our amazing team. Mala Infante, between the both of us, we manage the whole state of Florida and all agencies and FMOs within it. Kathleen Nevels, she is our Vice President of Operations. So we brought the big guns today. And Chris Staples, which is somewhere around here, he's in charge of the whole East region sales. All right. And obviously, as I said, Jorge Baste, he's in charge of our ancillary products. All right. So we're not the only part of United Healthcare on the ACA side that's here to help you, right? Obviously, being in Florida, majority of you probably sell in every single state. So we wanted to show you the whole crew, every single person that we have on the sales team that can help you sell a little bit more in whatever state you're trying to sell in. All right. Wanted to give you a little bit of backstory on where we've been and what we've been able to achieve since we've re-entered the ACA market, right? So as you can see, in 2021, we relaunched into ACA, and every year after that, we've been able to double our membership, and that's 100% thanks to you. So from the bottom of our hearts, thank you so much for trusting your clients in United Healthcare. And as you can see, for 2024, we have 1.5 million members and within all states. Now, beautiful map that we always like showing year over year so that you can see the expansions that we've been able to do every single year. So in 2022, we had 18 states, 328 counties, right? Doesn't seem like a lot when you're talking about nationally, but speed over to 2025, and now we're in 30 states and over 1,200 markets. Okay. I'll go over the new states for 2025 in a little bit. But one of the things that we always like doing is slow and responsible growth. That way, your clients, our members, aren't being hit with ridiculous increases in premiums year over year. We want to make sure that our pricing is as stable as possible so that it doesn't affect you or your members. And you don't have to be switching everybody year over year as much. So aside from expanding to 4 new states for next year, we're also going to be expanding within our existing states. So that's what this amazing slide is showing you, right? As you can see in Missouri, going almost state-based, right? Adding another 35 counties. We're adding another 12 counties in Texas, all right? And again, that's all thanks to you and the recommendations that you all give us about our plans. All right. So one of the things that we always like doing, or that one of the things that we learned from 2024, how many of you sold our Kelsey Siebold plan in Houston? All right. Amazing plan, right? So that plan is based on value-based care, right? Getting that smaller network, more intimate network with our members, right? And that's something that we're wanting to expand to other states. Okay. So you're going to start seeing probably similar plans on a national level. All right. In years coming. Now, 4 new states for 2025 with us, right? So you got Indiana, Nebraska, Iowa, and Wyoming. All right. Those are all new states for 2025. So if you're selling any of these states and you haven't gotten appointed yet, please do so because I do want to pay you for those enrollments. All right. And a lot of the details about all these states and the counties, specifically the hospital systems, we're going to be sending it to you guys. So there's a giant PDF with all states. Now, I wish all I was giving you today was good news, right? But unfortunately, there's only one piece of bad news that I have to give you, and that's that for 2025, we're not going to be partnering with HCA. Okay, HCA Hospital Systems, as you know, is one of the biggest ones in the nation. Fortunately, won't mention any details, but we're not going to have them in network so that our pricing wasn't as effective as it would have been. All right. Now that obviously causes a few exits, right? But it's just a handful of exits. So as you can see on the left-hand side, or actually on your right-hand side, in Texas, we're going to be exiting Corpus Christi. Florida, there's only one county that's going to be affected, and that's Pinellas. North Carolina, Asheville, and South Carolina suburbs. And I'll be honest with y'all, in Florida and actually in Texas as well, the membership that we had in those counties was minimal. So it's not going to be a huge impact for you and your clients. Okay. Now, this is a state that the slide, sorry, that I was mentioning that we are going to be sending to you. It's going to be a PDF with all 30 states. Lots of information for y'all. Okay. Pointing out every single county where we're going to be in for 2025. And most important, the hospital systems in every single one. Okay. And this is going to be for every single state, since obviously we are in Florida and I want to show extra love to Florida. This is the one of the only states that I'll be showing in the presentation. All right. But for Florida, remember, we're going to be in 32 counties for 2025. It is HMO, and they do our plans do require referrals. Our referral program from our providers extremely simple. All they have to do is, just like you guys have Jarvis, our broker portal, our providers also have their own portal, and it's literally 2 or 3 clicks that they need to do that referral. Florida's obviously pretty big, so we do have 2 slides. And in Tallahassee, obviously because of the change from leaving HCA, we will add Tallahassee Memorial for next year. Okay. Now in Florida, we also has cross-border coverage. So for those members that you have that live in Tallahassee or maybe in the Panhandle and they want to cross over to Alabama, they are able to cross over to Baldwin and Mobile County. And obviously, since you guys do sell a lot in Texas, I wanted to make sure to show some love for Texas as well. So as I mentioned before, our Kelsey-Seybold plan is only offered in 5 counties. All right. It's just in the Houston market. And I promise you, we do have more details about Texas. It's just Texas is so big. It had like 7 slides just in hospital systems and markets. So I dropped it down to 1 in the plan that you guys are selling the most. All right. Now, what you actually came here for was to learn about our product for next year. What we try to do year over year is just try to keep it as simple as possible for you to be able to sell our plans, not just in Florida, but on a national level, and kind of keep the same benefits, same strategy nationwide, right? So probably a slide that seems familiar for you guys, right? So for 2025, we're going to have just 4 product categories or product families. Our required plan, which are the same for every single carrier. All that changes is just the network and pricing. Our value plans, which are our plans that are more similar to other carriers. Our advantage plans, which are designed for those members that you might have that are leaving employer coverage, are used to those lower co-pays, co-insurance deductible. That's what those plans are designed for. And our best plan for 2024 so far are copay focused plans, which are designed for $0 medical deductible in bronze, silver, and gold. All right. That's our #1 plan here in Florida and in most states. Now, one product family that you probably are thinking about was our very famous virtual first plans that we had a lot of feedback. And thanks to your feedback, we are no longer going to be offering those plans for next year. Okay. Now, our #1 plan, as I said, nationwide was our copay focus, where 34% of our members were actually enrolled in that plan. Okay. So if you were part of that, of those agents that were selling that plan, thank you so much for trusting in the plan. And the plan is designed for our members to know exactly how much they're going to be paying for all of our benefits, right? There's nothing worse than having to think about, I have to get a surgery. How much am I going to pay because it's 30-40% co-insurance, right? You don't know how much that's going to be until you see the bill. What this plan offers you is that exact same thing, knowing exactly how much you're going to be paying. And just like we had for this year, we're going to give you a PDF that shows every single plan that we have side to side so that you can compare it, right? Makes it easier for you to showcase plans for your members. Now, some things that you might see a little bit different are those nice red letters. So for next year, we actually have a pretty good strategy for off exchange, where we added 3 plans here in Florida that are only going to be offered off exchange. Okay. And another thing that we added for next year, well, this page is obviously the same. It just shows all of the generic medication and brand medication copays. But all the way to the right, you'll see a lot of you also had asked us like, why don't you guys have any HSA plans? We heard you loud and clear, and we were able to add 2 HSA plans. Now they are going to be off exchange only, okay? But another thing that we did decide to do was increase the amount of plans that have adult, dental, and vision. So those you will see with a nice plus sign, okay? So any plan that you see, it can be a copay focus plan. It could be a value plan. It could, well, this year we already have the Advantage plans, but if they have that plus sign at the end of the name, it does have adult, dental, and vision. One of the reasons we did that is because of the CMS regulations that now only allow carriers to have the required plan plus 2 different ones, right? So that you have a little bit more options to showcase to your clients. That's why we were able to add some of those dental and adult dental and vision. Now, when it comes to the vision side, right, for adults, and I'll explain it for both pediatric side and our adult side. Every single one of our plans has pediatric and vision and dental, okay? Every single one of our plans. Now, on the pediatric side, you'll see that it is attached to the medical deductible and coinsurance for each plan, right? So it all depends on what plan you enroll them in. That depends on what the coinsurance and the deductible is going to be in. Routine vision exam for pediatrics, $0. And then on the adult side, for those plans that will have the adult dental and vision, for those plans specifically, you'll see $25 copay for lenses. Last year we had, or for this year, we had $105 for frames. We actually increased it to $150. That's going to be covered for frames. And contact lens, formulary contact lenses are going to be $25 copay. Now, on the dental side, nothing changed, right? So it's going to stay exactly the same as how we had it for this year. But on the pediatric side, and again, every single one of our plans does have it. The only exceptions are going to be in Colorado, Washington, New Jersey, and New Mexico, where we don't offer the adult side, okay? But on the pediatric side, no charge for preventive, right? That's already included into the plan. And if minor and restorative services, copay, deductible plus coinsurance, right? Now, I know it says orthodontia, but just please keep in mind that is only for medically necessary, okay? But we do cover orthodontia for pediatric as long as it's medically necessary. And on the adult side, best part is no waiting period. I know a lot of the ancillary products that you might sell have waiting periods. These plans that already have it built in do not have any waiting period, and they have up to $1,000 dental benefits a year. And the preventive is $0, but it does count towards the $1,000. And for minor and major restorative services, it's 50% coinsurance. Now, if you're asking about the Galileo, right? You're thinking, oh, didn't you just say that virtual first went away? It did, right? But we kept Galileo because for those members that you might have that do like that virtual PCP option, we wanted to keep that available, right? It's still going to be the same copay for the plan, but you'll have 24/7 access to a PCP. To do an appointment, it's fairly quick. Less than 24 hours, you already have an appointment. Versus doing it in person, you got to wait quite a bit, right? Like I just changed my PCP and I had to wait probably 3 months to see my PCP, right? Now, for virtual urgent care, we have Amwell and Doctor on Demand. I personally use Doctor on Demand quite a few times, and amazing service. And that's something that our members are going to have for $0. Now, on a national level, again, to make your lives easier, we want to try to keep our benefits as similar as possible. So, behavioral health is a benefit that you also ask us if we could lower the copays, right? Make sure that we could, I don't know, fix it up a little bit. So what we did is that we attached the PCP copay to that mental health copay, okay? That way it can be a similar one. Another benefit that you guys told us is like, this is very limited in Florida, right? In Florida for 2024, we only have 2 plans that have insulin for $0 copay. It's not a diabetic plan. It's just a benefit that we wanted to offer for our members. So for next year, thanks once again to your feedback, every single one of our plans here in Florida is going to have it. And the vast majority of our plans on a national level are also going to have that $0 copay for insulin and diabetic supplies. So talking a little bit more about that diabetic benefit, right? And again, it's not a diabetic plan. It's just an additional benefit that we have on all of our plans. It's not just that insulin, it's also a lot of the lab work that our diabetic patients have to do, all right? They're also gonna be $0. For prescription coverage, CMS did make a change, right? I believe it was for 2024, where everybody has to have that tier 1. Those are the regular preventive medications, and all carriers have to have it for $0. All right, so every single tier, it's just got bumped down once. So tiers 2 and 3 are our generic and preferred brand, right? Another benefit that you guys also told us that you liked, or that your members liked, was that every single one of our members also receives a little card in the mail from Walgreens that basically gives them 20% discount on all Walgreens branded over-the-counter medications, right? So aspirins, vitamins that are Walgreens branded, those are gonna be 20% off with that barcode. Another benefit that we are going to continue for next year is our virtual fitness app, right? With OnePass. On the digital side, it's going to continue to be $0. But for those members that you have that want to continue to go to that in-person gym, they're going to be able to basically buy into a different program, right? Through OnePass, nothing to do with our premium, right? So it's going to be directly through OnePass, and it ranges, the classic is around $24 a month, and it gives them access to LA Fitness, Snap Fitness, and it goes all the way up to Elite, which is around $120, $124, I think it is, for those high income members that you might have that are going to Lifetime Gyms, Orange Theory. Those are two of the ones that are included. And obviously, you get all of the other ones. So you're thinking 120, that's a lot. That's most likely what Orange Theory is already. So you just get access to all the rest. Another benefit, once again, I know that I keep thanking you guys a lot, but a lot of the changes that we make year over year are actually thanks to your feedback. So the more feedback you give us, the better plans we're gonna have in the future. But one of the biggest benefits was that $100 that we had for this year was just not enough. So for next year, we actually increased it to 150 and we separated it, right? So we're gonna have $100 just for going to that doctor, just for going to that PCP visit, that annual visit. That ends up being free anyway. And then the other $50 are going to be for the same steps that we had for this year, right? Creating that UHC account, going paperless, signing up for text messages. The text messages, I'm personally signed up for them. They're a little bit different. They're not sales oriented. I am horrible for asking for my medications, horrible. So every 3 months, I get an email or a text message from OptumRx reminding me, it's like, hey, JP, we haven't seen a claim for your cholesterol medication. Don't forget to get it. So that's the type of text message that you'll receive from us. And obviously, signing up for autopay. If your members have a $0 premium, one less thing they have to do. One ask that I do have for you guys, it's gonna be the same Visa debit card, right? So tell them not to throw it away. So if they get the $100, we're gonna load the other $50 into that same card. And it's a Visa gift card, so they can do it for whatever they want, whether it's restaurants, getting gas, or paying for their premium. Now, these are a few of the examples that we're gonna have out in the market when it comes to marketing, right? We wanted to focus on our relationship, the relationship that we have with our UnitedHealthcare members and the loyalty that they have for UnitedHealthcare. Now, another PDF that we'll be sending you is phone numbers, right? Who doesn't like 101 different phone numbers? But they're for every single member services for every single state, okay? And now for our operations side, all right? I know that a lot of you probably remembered the toolkit. Went away with that, right? Too many clicks. So we've actually put it simpler in Jarvis. That way you have quick and easy access to sales tools that you're able to use to promote yourself and United Healthcare. Other great thing about it, you have retention flyers, right? So you have flyers that you can use 30, 60, and 90 days after the sale. The more you touch your client, less chances they'll have of leaving or going with anybody else. Another thing that we heard loud and clear from you is like if our members had some videos to show them how to use My UHC, show them how to look for doctors, that would make your lives a lot easier, right? We added that. Our amazing operations team added a whole page just full of video links that you are actually, if you use any CRMs that you can actually text through the CRM, you can send them all the links to the videos. Makes your life a lot easier. And of course, being in Florida, being a Hispanic myself, very proud of our initiative to have more Hispanic materials. Okay, so we actually have a whole team, our Hispanic Initiative team. We have our Hispanic Initiative Director in Arizona, Texas, and here in Florida. So a lot of the things that you'll have access to in the sales and marketing page, like I said, Facebook posts, flyers, onboarding, right? So if you're an agency and you're trying to onboard a few agents, you'll have a lot of information there to help them. Now for our brand website, if you want to order any brand materials like that amazing banner, they're going to be available for you as well. Just go to brand.uhg.com and it'll take you to this page. Just quick reminder, obviously, if you've never been into that website, you're going to have to request access and just create basically a login. Now, a lot of changes that we've made to Jarvis, we made the page a lot simpler. We put all the reports that are available to you all the way at the top, your book of business, right? One-click emails. So if you have on the right-hand side, you can clearly see that you have late payment report, when they're turning when members are turning 26 and obviously when they're turning 25, if you 65, sorry, if you go into those reports, there's an email sign on the right hand side, pre-populated email that's being sent from your email to your clients, reminding them if they're turning 26, hey, you most likely have to go on your own policy, or turning 65, let's get you over to Medicare, right? What better way of building your book of business on the Medicare side than already having them on the ACA side? So a lot of the other reports that you'll have is obviously your book of business. You're able to transfer that to Excel. Makes your life easier, especially once you have over 100 members with us. Approved applications and of course pending applications for those clients that haven't paid their binder payment. Quick and easy access to those members. And of course, like I said before, a lot of Spanish material, Spanish rollouts. Madai and I are going to be doing once a week Spanish and English virtual trainings starting on the 24th in English, 25th in Spanish. All right. And it's going to go every single week until October. Compliance, right? Couldn't leave today without asking a tiny other favor from you, right? I'm not going to give you a whole spiel about compliance. The only thing that I ask is if you see an email from United Healthcare Compliance, please, I beg you, do not ignore it because that could lead up to terminations, right? The reason why we take compliance so serious is because obviously we're trying to protect our members, your clients, and of course you, especially with everything that's been happening on the compliance side. A lot of changes. Extremely happy that we had the change on July 29th. I think that's a date that might be booked in all of our calendars. But speaking a little bit more about compliance, you also have a lot of compliance resources in Jarvis. You have FAQs that are directly taken from CMS, right? So a lot of good information that you're able to use if you have an agency to train your agents a little bit more on compliance, or just for you to have a little bit more information. We actually have a really nice training in Jarvis as well. And of course, Madai and I are not the only ones that are here to help you. We also have an amazing producer help desk team that's available for you Monday through Friday, 7 to 9 p.m. Central Time. So that gives us an extra hour. And fresh off the press, we actually just got a few Spanish-speaking producer help desk members. So if Spanish is your first language, or if you have any agents that prefer to speak Spanish. We do have a whole team straight out of Puerto Rico. All right. And that is it for me. I'll leave y'all with Jorge Baste.
All right, great. So JP has gone over everything and anything on the IFP side. I'm going to do something a little bit different. My name is Jorge Baste. I'm the National Sales Director for UnitedHealthcare, the Golden Rule Insurance Company. A lot of you know us as UnitedHealthOne. And our side is the ancillary side. You know, basically what I'm going to be talking to you guys about today is need-based selling, right? You want to meet your client's need. If you guys are already selling ancillary products, supplemental coverage, fantastic. If you're not, you're missing a lot of commission dollars and you're really possibly not meeting your client's specific financial needs. So that's what we want to do today. I used to listen to, and I still do, Zig Ziglar. I don't know if anybody here knows Zig Ziglar? Okay, well. And I would listen to these recordings over and over again, and he had one quote that he says, "You can get everything in life you want if you just help enough other people get what they want." I'm going to change one word in that quote. You can you can get everything in life you want if you help enough people get what they need. And that's what we're going to be talking about today. So let's go ahead and get started. And again, you want to be viewed as a trusted advisor. When you offer more than just one product and you meet the client's true financial needs, chances are that client's going to stay with you a lot longer, and they're going to view you a little different than just, running the mill insurance agent. So let's look at our portfolio. Like you guys have on the IFP side, we do have dental, we do have vision. Okay. Dental and vision, the way I see it, and maybe some of you guys have encountered this, is I think it's more of a transactional sale. The client many times is going to ask you for that. They're going to go ahead and ask you for it. Of course, you're going to sell it to them, right? I think you need to be concentrating on critical illness, accident, and hospital. Those are the true products that meet financial needs. Those are the true products that are going to have longer retention, longer persistency on the books, which is extremely important for us. We need good persistency. We need good retention in order to continue to offer products that are competitive both in premium and in benefits. Okay. We also have some non-insurance products which are very interesting. Where are we nationwide? We're in 49 different states. The only state we don't have anything in is New York. Every other state will have at least one product line, and most of them we have several. Surveys. We like to look at a lot of data over at UnitedHealthOne, over UnitedHealthcare in general, right? DEFS did a survey, and they asked agents during the sale of a medical plan, did you ask or did you mention any other products? We found, not we, but they found that almost half of the time the client did not do it. Big mistake. Those that did, the other half, 67% made a sale, an ancillary sale. And of that 67%, chances are they probably made more than one ancillary sale, possibly two. Okay. What products were discussed? Of course, life insurance. Life insurance is extremely important, no doubt. But the reality is, yes, it meets your client's financial need, but what you're doing there is you're really meeting the beneficiary's financial needs. Dental and vision, again, transactional. Many times a client will ask you for that. Okay, you're going to make the sale. Again, focus in the middle there, accident, hospital indemnity, critical illness. Those are the products, again, that are going to have very good retention and are going to truly meet your client's needs. Let's go ahead and continue. Did you know? Hopefully you did. If you didn't, now you do. Just by selling two ancillary products, two of our lowest cost ancillary products, our Dental Wise 1000, that is one of our lower cost dental plans, and our Accident Wise 10,000, excellent benefits. You'll see that in just a minute. And those two sales, as far as your first year commission, will end up being higher than your typical ACA policy. If you have an ACA policy that pays $25 a month per insured, they're the numbers, 121% higher. All you have to do is take 5, 10, 15 extra minutes with your clients. I know you're busy. I know open enrollment is a marathon. But if you just take those extra 5, 10, 15 minutes, you can double or more than double your income in the first year. There's a myth. This is another survey, right? There's a myth that the household income, or those that have a household income of less than $55,000, will not buy any ancillary products. That's absolutely false. Here's the data. 34%, 34.2% to be exact, of ancillary sales come from that market. And if you think about it, that's the market that really needs it. They don't have $5,000 or $10,000 stored away in a savings account for an emergency. Unfortunately, well, a few people do, but they truly more than likely do not have it. So that critical illness policy that can pay up to a $100,000 benefit per category can really make a difference in the, in that market. So again, don't be scared. Don't be scared to ask that client questions. One simple question. If you're hospitalized due to an accident or an illness, do you have the money or the funds to pay your bills if you cannot work for a while? We just opened up the conversation for hospital, accident, critical illness, cancer, heart and stroke. One simple question. If you don't make the sale right there, you just planted a seed in that client's mind that they may have a need, and you're going to be able to meet that need for them because we're going to have the solution. Okay, so the next time you talk to them, you just kind of remind them once again. Household income, well, medium liquid assets compared to the maximum out of pockets. As you guys may well know, maximum out of pockets on ACA policies this year is $18,200 for a family, $9,100 for an individual. If you do the math, the average medium liquid assets in a household is about $5,000. We've seen, I don't have that slide on here, but my presentation would be too long and the guy would kill me. But we've seen that a lot of the bankruptcies in this country, 67% come from unexpected, well, from medical debt. And of those 67%, many of them had health insurance or medical insurance. They just had very high out-of-pocket expenses, and that contributed, unfortunately, to some of those bankruptcies. So again, that goes to show you can give your clients that solution. I'm going to go over 4 products very quickly because we're limited on time. Before I do that, well, this is our first one. This is our critical guard. Very, very important. And I'm going to repeat this twice. UnitedHealthOne does not require a social security number for your clients to apply on our products. That's extremely important, specifically in the Hispanic market. One more time. We do not require a social security number to apply to any of our products, except, put that stipulation in there, except for our life insurance product. That's the only one. Everything I'm going to cover here can be done without a social security number. Okay. So our critical guard plan, I'll be very quick here. We have 4 options. Plan 1 concentrates on cancer. Plan 2 concentrates on heart and stroke. Plan 3 covers cancer and heart and stroke. And Plan 4, our best-selling plan, is going to cover cancer, heart and stroke, and other critical illnesses. And in addition to that, at the bottom, we see we do cover some other benefits. All of this is available on the brochures. Brochures are in the agent portal, or what we like to call the e-store. We have them in English, and we have them in Spanish. And I just got the news yesterday from Santiago Irurita, who is our Vice President of Hispanic Initiatives that's joining us today. We will have training videos in Spanish in our website, in our portal very, very soon. Okay, so that's coming. So anyways, all this will be on the brochure. This gives you a really quick snapshot. Next, we have accident-wise. This is our accident plan. We have 4 options. Okay, we got plan 10,000, 15,000, and 20,000. Besides the lump sum benefit you get if you're hospitalized due to an accident, we have many other benefits. I'm not going to go through them in detail right now, but look at the premiums at the bottom. $1,546. That's our lowest cost plan. That's the one we showed in the example a few minutes ago. Our best-selling plan is plan 15,000. Benefit, the premium, it is definitely the best option. Okay. Health Protector Guard. This product is a great solution for those clients that you have on the ACA that have a high deductible. This is a fixed indemnity product. It gives them first dollar coverage, can be sold as a supplement to that type of someone with a higher deductible, higher out of pocket. It can be sold as a standalone. Remember, you don't need a social here. If you have a client that doesn't qualify for ACA, 1 minute. Okay, I got 1 minute. I'll be done. I'll be done. I'll be done. I promise you. So keep that in mind. Okay, that can be done without a social security number, and it can be sold as a standalone as well. What does it cover? Very quickly, we've got hospital benefits it's going to cover anywhere from 1,000 to 5,000 per day, unlimited days. It's going to cover surgery up to 50,000. It's going to cover emergency room. Work X benefit, what is that? Well, it's wellness, office visits, and RX. Those will be covered as well if you add it to coverage. And lastly, maximum out of pockets, 2 million per calendar year, 5 million lifetime. And lastly, we have our dental wise. Okay.
So I'm rushing you and just saying because we started late.
We did start late, but everybody else is running late too. Everybody's running late too. This will be really quick, okay? Dental wise, this is our dental suite of products. I'm going to concentrate on that middle one, Dental Wise Max. Why? Because it covers dental, vision, and hearing all in the same policy. I'm not going to go over the benefits, but just know something that everything is covered from day one, no waiting periods, except the two options that have implants, and they'll have a 12-month waiting period for implants. That's it.